welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia. All of us are seeing so many viral illnesses out there, adults, kids. It seems like everyone's sick right now. So we thought it'd be a good time to bring in a pediatric ER doctor to tell us what things are looking like in our emergency here in London. So Dr. Sheena Belisle will be joining us, and Dr. Belisle will be with us right after this break. Welcome back. So again, we're pleased to be joined today by Dr. Sheena Belisle. Dr. Belisle is a pediatric emergency room consultant at Victoria Hospital, at Children's Hospital here in London, and she's an assistant professor at Western University. So Dr. Belisle, thanks for joining us today.
Thanks for having me.
So we thought this would be timely. We haven't done any episodes related to anything infectious in a while. Obviously, when our show started, we were really heavy into COVID and probably did almost 6 months, I think, episodes, and everyone probably got sick of those. And we were in a kind of a good run for a while where we didn't have to really talk about much infectious related. But we've unfortunately been seeing kind of an uptick, and we've kind of all seen news reports of volumes in pediatric emerges kind of right across North America going up. So I thought it'd be good timing to bring someone on like Dr. Belisle, who can give us kind of a sense of what's going on in our pediatric emerges, and some information for both parents and kids on what should we know, when should we be presenting to emerge, what things are concerning. So I'm really happy to have Dr. Belisle joining us today. So I guess we'll start with kind of a sense on the ground. I know in our clinic, so obviously I'm a family doctor, our clinics have been busier than ever with viral illnesses. We're seeing, like, in my career, my 10+ year career, I've never seen this many viruses coming through my clinic. What's your experience been in Peds Emerge? Like, what's the situation on the ground here in London?
Yeah, so definitely within our pediatric emergency department, our volumes are way up. So right now, our daily volumes are averaging anywhere between 50 to 75% above our baseline volumes. And this translates into about double what our normal wait time would be. And so, as you alluded to, like, this is not unique to London. We're definitely seeing this across the province. We know that respiratory illnesses are really the predominant concern that are coming in. Within Ontario, we know that about triple the number of pediatric patients are presenting to emergency departments across the province with concern of respiratory issues. And about triple the number are actually requiring admission as well. So definitely a problem across the province, and we're experiencing it here in London as well.
And we really didn't see, typically in the summer, we see a bit of a dip in people presenting with viral illnesses. And in our clinic, and I think in Peds Emerge too, we didn't really see that dip like we normally do, because there was still, Coxsackie, so hand, foot, and mouth was still going around for a while, and some other viruses. Was that kind of your experience there in Peds Emerge too, where we didn't really see that typical summer dip and we're kind of starting from even a higher baseline than usual?
Yeah, definitely. Even throughout the summer, we were continuing to see bronchiolitis, which typically we don't see in summer months. And that's caused generally by RSV. And so RSV is really on the rise right now, but you're right, like, it never actually completely went away, which is unusual.
I guess we'll talk about respiratory viruses to start. Kind of what viruses are you guys seeing come in, and kind of what kind of presentations are you seeing quite a bit in an average shift that you have?
Yeah, so definitely a lot of RSV, as I mentioned. Also, we're seeing some enterovirus. Influenza is just starting, and we're still seeing COVID as well. So we can't forget about COVID-related illness. So lots of bronchiolitis, also seeing lots of pneumonia, which can be both viral and bacterial.
Are you seeing a lot of bacterial pneumonia? I know in our clinic, it's obviously been predominantly viral. Haven't seen a ton of bacterial. Are you guys seeing quite a bit of, a fair bit of bacterial pneumonia as well?
We're seeing enough. Yeah. We're seeing a mix of both for sure.
And seeing an uptick in admissions to the ward and the ICU as well, would you say?
Yeah, definitely. And I mean, as we've already talked about, like, the strain is across the province and across the country. So ICUs, pediatric ICUs are at capacity. I'm hopeful that with the recent announcement from the government that adult ICUs are encouraged to start taking the younger population, so 14 and above, that this may help to take some of the strain off of our pediatric ICUs. But definitely we're full.
I'm going to forget if I don't bring it up now, the importance of the flu shot. So I'll put a plug in right now. It's a question we get from parents quite a bit. Should I be worried about the flu? Should I be having my kids get their flu shot? I think it's fair to say that this year more than ever, we want to do whatever we can to keep kids healthy out of emerge. And even though there's a lot of different viruses that could cause a bunch of different illnesses, if for those of you who do have younger kids, getting their flu shot, because if we can reduce the risk of even one illness in one group of kids, keeping people out of emerge, keeping people out of hospital is going to be important. So more important than ever to get their flu shot, and obviously their COVID vaccination too, if they're eligible. We'll talk about some specific conditions later, which I know parents will have a lot of questions about, but let's start with kind of general advice for respiratory illnesses. So I'm sure at the end of every shift, there's kind of a few cases that you look back and think, I wish parents had known this before they either did or didn't do something related to their kids' health. So what are some pearls that you wish you could impart to parents about seeking care in Peds Emerge?
I mean, in terms of providing some reassurance, one would be that cough is very, very common. We're seeing a lot of kids coughing, unfortunately, for a long time. There's not a lot that you can do about the cough. There are some sort of things that you can do to help in terms of comfort measures. So having your child sleeping like propped upright a little bit, like with an extra pillow, using a cool mist humidifier, keeping them well hydrated, clearing out any nasal secretion. So making sure that their nose isn't really congested can also help with cough. In the younger population, definitely using some nasal saline and suction. So those are the nasal aspirators that you can purchase at pharmacies. The ones that you actually put to your mouth that you can suck on, you can definitely generate better suction, more so than the bulb aspirators. So encouraging parents to use those. And then for older children, you can use saline rinses, and they can be quite effective if you can encourage your child to use those. So just providing a little bit of reassurance around cough and the things that you can do. Really, any over-the-counter cough medications are not recommended in children. So we would advise to stay away from those. In terms of reasons that we really want to see you in the emergency department, for sure, would be if you have any concerns that your child is working hard to breathe. And so what we mean by that is breathing very fast, sucking in underneath their ribs, between their ribs, flaring their nostrils out, or tugging up in their neck. That tells us that your child is in a lot of distress, and we definitely need to see them in the emergency department. Also, if you're hearing any like audible wheezing, you can hear that they're struggling to breathe, we need to see them. So those would be just sort of 2 tips that might help people to decide whether or not to come. But again, at the end of the day, if you're very worried about your child, we're here for you as, emergency medicine providers for children. And if you're worried enough that you think they need to come to the emergency department, that's what we're there for. We're happy to look and, help.
And it's one thing Dr. Belisle and I will, for audience out there, we're, very careful to not tell you, not to present if you have, these symptoms or absence of these symptoms, because ultimately, if you're concerned, whether it's your family doc or Peds Emerge, are definitely there to see you and to provide care. Because as we said, yes, most coughs sometimes last up to 3 weeks, but some of those coughs within the first 3 weeks could be pneumonia, and we don't want people to necessarily sit on those. But those red flags are really important. That a cough with a fever, a cough with issues with breathing, a cough with vomiting, those would kind of steer us more towards more kind of an active set of investigations and treatments versus someone perhaps with a cough alone. So we'll tackle some specific conditions. So one that we've been seeing a ton of, again, I'm not sure how many of these patients come to a Peds Emerge, but certainly in our clinic, we see a lot of it, is eye infections. I think I've seen probably more in the last 2 weeks than in any 2 weeks of my career, I can confidently say. Patients are often asking for drops and thinking that's going to help. What do you tell us kind of around eye infections in terms of what you tell parents and what we use to treat these and what we can tell parents?
I'm totally with you. We're seeing a lot of eye infections. So pink eye is what most refer to these eye infections as, and definitely they're on the rise right now. Generally, these eye infections are viral. And so they're self-limited, meaning that they do not need any treatment. But it's always very tricky for us to know whether or not they are in fact viral or bacterial. We start to think about bacterial cause when there's a lot of discharge, when it's very thick, when your child's waking up in the morning and the eyelashes are sort of glued shut. That starts to make us wonder whether there may be a bacterial cause. And in those cases, we usually recommend that they try just over-the-counter eye drops. Usually the polysporin eye drops is what we recommend. So it's not something that you need a prescription for.
One thing I'll add to so yeah, we talk about pink eye. So people ask, is pink eye bacterial, viral? It's kind of the casual term for kind of all conjunctivitis, so viral and bacterial. We said we're seeing a lot of it both in one eye, in the other eye as well. Don't be surprised for parents, even with a viral pink eye, your child's eye may be just caked in the morning. So if you clean it first thing in the morning and it's pretty good during the day, maybe some discharge you have to clean every maybe hour or two, probably not a bacterial source. The things that would concern me, I'm just going to add one thing quickly. The things that would concern me too is if you're seeing quite a bit of redness extending kind of beyond the eyelids, kind of in the area around, that may be more of a bacterial source. I may actually need oral antibiotics if that happens. And if they get quite a bit of swelling on the inside, like where it's actually swollen red. I actually saw one in the last week, like a dacrocystitis. That's different than your usual kind of, viral conjunctivitis. So that would require treatment. The one thing that parents talk about the most in I find they come to see us, and I'm not sure if you guys see these patients too, when they're in daycare and they're told by the daycare provider that they can come back to daycare if they're on drops for 24 hours. It's the worst possible policy ever, because these are viruses, and treating them with drops and telling them they can come back as long as they're on these antibiotics that aren't going to actually do anything. So if you're ever told this by a daycare provider, please ignore them. Don't go on the drops, because it's going to create false reassurance and keep it going to other kids in the class. And it's not actually going to solve any issue. So the kids really should be discharge free for 24 hours from their eye. And I can tell you personally, because my daughter still has pink eye after about 4 days now, and it's still gooping. So we'll move on to sore ears. Again, something I'm sure you're seeing maybe a few cases of sore ears in Peds Emerge. Can you tell us, again, question that comes up with parents, when do I need antibiotics for kids' ear infection? Because everybody coming with a sore ear is convinced that they need antibiotics for their ears. So how do you kind of decide who needs antibiotics for ears and who doesn't?
Yeah, so it's a good question, and definitely a very common complaint that we see in the pediatric emergency department. So again, I'm feeling a little bit like a broken record, but like the vast majority are viral, and again, are self-limiting, meaning that they will go away without any antibiotics. But in terms of like sort of trigger points for us that would prompt us to start treatment with antibiotics and make us think of a more bacterial cause would be severe pain. So we usually think of that as pain that is not allowing the child to sleep after having given them ibuprofen. Prolonged course of illness, so meaning that they're sick for more than 2 days or 48 hours. So that's with fever and complaining about ear pain. And then the other one that we think about is higher grade fever. So fever is greater than 39 degrees Celsius. So those are sort of the 3 trigger points that make us think that maybe we should start antibiotics.
And does age play a role in when you would be more likely to give antibiotics or not?
Yeah, so that's a really good question. Definitely age does play a role, and we have much lower threshold, meaning that we hesitate less to treat in the under 2. So if your child is under the age of 2, and you're worried that maybe they have an ear infection, it's worth getting them checked.
And it's something we commonly see in those over 2, when they have an ear infection, and we take an approach often with a lot of patients, watchful waiting, where we'll advise them that within 48 to 72 hours, really, if they're over 2, that ear infection, if viral, should be improving. If not, then we would consider antibiotics. I know in family practice we do this, and probably some emerges as well with like a delayed prescription. Here's a script.
Yeah.
Don't fill this unless it's gone on this long. Is that something that you guys sometimes do in emerge as well?
Yeah, definitely. Yeah.
And the one thing too, Sometimes people have drops lying around from previous outer ear infections. Please never use those drops if a kid has a sore ear, because we don't know what you're treating necessarily with that. It's important that if it's bad enough, again, for the reasons Dr. Belisle said, if there's severe pain or persistent fever, or kind of any symptoms you're concerned about, really should be evaluated first before parents are using drops on their own. We're going to take a quick break, and we'll be back with more from Dr. Belisle right after this message. And welcome back. Again, we're joined today by Dr. Sheena Belisle. She's a physician at Children's Hospital here in London in the Department of Paediatric Emergency Medicine. One thing that comes up quite often, obviously, with really small people, is the idea of fever, and how do we manage fever in babies and neonates? And so in Emerge, what would you say your approach is, and like when should parents be bringing their kids to Emerge with just fever alone, with nothing else going on?
Yeah, so I think that this is a really important topic to address. So anytime we have a baby that has a fever less than 3 months of age, we really do want to see them in the emergency department. We know that the younger children are, the harder it is to know how sick they are. So fever alone should prompt parents to bring their children in if they're under the age of 3 months. And so we would define fever as 38 degrees Celsius or higher.
And yeah, it's such an important one, because as kids get older, especially if it's their second, third, fourth kid, they're used to just treating symptoms, treating fever, and it's really important to reinforce that in those first 3 months, that any fever can't be ignored, can't be just treated, needs to be evaluated for sure. So I'm really glad that you raised that today. We'll go back to dealing with some specific symptoms. So sore throats is another one that we're seeing a ton of. Feels like they never really went away over the summer, since we've been dealing with it for months now, but obviously a lot of people are having sore throats now. And people coming in are always convinced they have strep throat, and always wondering, do I need antibiotics for this? That's often the main question. So in Emerge, how do you tease out for patients? Is it viral? Is it bacterial? Do they need antibiotics? Do they not? What's an approach that you would take?
I mean, a lot of it really is within the history. So if the child has many of the other viral symptoms, most likely it's a viral pharyngitis or a viral sore throat. So that means if your child is having a lot of cough, if your child is having a runny nose, that would indicate to us that it's more likely to be viral than bacterial. And then if we're concerned that it does look more like it may be bacterial, often we will do a throat swab.
For people at home, don't forget COVID is still going around and still quite a common cause of sore throat, so don't hesitate to do that. One approach that I can share with patients, there's kind of a scoring system that we use to kind of have a rough idea of whether someone's maybe going to be steered towards more bacterial or a viral. So if they've got a fever, if they have an absence of cough, if they have pus on their tonsils, or if they have tender nose. Now, people can have those or not have those, and it doesn't necessarily, you don't have to have all 4 to be bacterial, you don't have to have 0 to be viral, but each of those kind of steers us a little bit more towards having a bacterial infection. So certainly a sore throat and a cough, not always, but often will kind of getting us thinking more of a virus. So again, if concerned, if you see pus and tonsils, if having quite a bit of trouble with swallowing, if you see your uvula tilted in one way or the other, these are all reasons really to see your doctor right away. And again, if concerned, don't hesitate, because it is a pretty quick check. But just knowing that we are seeing a lot of viral sore throats right now. We'll talk about COVID really quickly. I know it's kind of tricky because we're seeing so many viruses, and not everyone I know in Emerge is being tested for COVID. But are we still seeing some COVID in Emerge? And I'm not sure if are we still seeing some admitted to the wards in here in London? I'm not sure what you're seeing.
As you've alluded to, it's a little bit hard to know just because we aren't testing everyone for COVID now. But my sense is that we're still seeing some COVID, and some children admitted to hospital are testing positive for COVID. But the vast majority are other viruses.
And again, a reminder to parents, similar to the conversation we had earlier on the flu shot, And COVID vaccine, safe in kids, if effective to a certain degree in bringing down likelihood of symptoms. So if your child has not had COVID in the past 6 months and has not had their initial primary series, definitely consider getting it, because it's just one fewer illness that you may have to be dealing with. I know in our household, I think we're on virus number 4 or 5 in the last few months, just because there's so much circulating. I'm sure my kids had adenovirus once. I'm sure they had enterovirus. I'm sure they did have hand, foot, and mouth for sure. We had COVID. So again, one fewer illness that you can deal with as parents, the better. So it's going to be important to get the flu shots and COVID shots for this year. What kind of advice are we giving parents in terms of return to school? I know it'll depend on the illness sometimes too, but is there any kind of general advice on, so if they've got a sick kid, when we think they're ready to go to school? Because I know this is something that parents often struggle with.
Yeah, as you say, like it does really depend on what the child's symptoms are. But as a general sort of umbrella statement, it would probably be no fever for 24 hours and overall improving. So symptoms overall moving in the right direction.
Move on to kind of Tylenol and Advil and over-the-counter. Obviously, this has been in the news quite a bit the last few months with kind of big-time shortages, and I'm sure that you're getting kind of questions from parents as well. Frustrated parents, difficulty accessing these meds. Any advice that you're giving these patients in Emerge about kind of dosing and what options they can look at to get their hands on Tylenol or Advil?
Yeah, so definitely a very difficult situation right now, and I know very stressful, or at least adding to the stress for parents when they're trying to find, antipyretics or fever reducers, pain medications for their children. One thing that we've really been stressing in the pediatric emergency department is teaching your child how to swallow pills. Definitely there are a large number of children presenting that are still taking, liquid or chewables that could be swallowing pills. So I think that that's something that we really need to stress. So young children can be taught to swallow small pills. And we know that those are much easier to get our hands on. So that would probably be one really important piece of advice for parents.
Perfect. And we'll actually include a link on the screen right now. There is a resource from out west from Calgary from Bonnie Kaplan about how to swallow pills. That can often be helpful to parents. We'll include that on the screen right now.
Yeah.
One more question about kind of coughs and bronchitis. So lots of parents worry when their kid has a cough, and we talked earlier about how they're mostly viral, but they worry, could it be bronchitis? Could it be pneumonia? What would lead you to order an X-ray in a kid in Emerge?
There are many factors that play into the decision to order an X-ray in a child. A number of things that would be included in that would be how long the fever has been. So when we start to get into fevers 3 to 5 days or longer, especially if the cough is overall getting worse, those would be things that we would take into consideration. Also, of course, if the child's having significant difficulty breathing, like we talked about earlier, and then it would also depend on our exam. So what we hear when we listen to the chest.
And I would remind parents too, I know like we're dealing with so many respiratory illnesses and we kind of get blinders on when it comes to if they got a fever or it's probably something viral. But I know even as clinicians, we need to remind ourselves too that everything else that causes a fever is still around too. So if it's especially a young girl who can't communicate well, who has a fever with no other symptoms, that's kind of lingering for a few days, it could very well be a UTI, because we do see those from time to time. If it's a fever in a kid with abdominal pain, appendicitis is still around, hasn't gone anywhere. So not forgetting about those other causes, and not getting our blinders on too much when it comes to fevers. Great. Thanks so much for all of this great advice today, Dr. Belisle. Hopefully, I'm sure a lot of the parents and kids watching it hopefully take some pointers from it, and cross our fingers that we finally have a quieter season, although I fear that we've got a number of months left of respiratory illnesses kicking around. But thanks so much for your advice today.
Thanks for having me.
As a reminder to parents out there, Children's Hospital does have a virtual clinic that is available every day, including holidays, from 3 p.m. to 7 p.m. Appointments are scheduled on a first-come, first-served basis. We'll include the website on the screen right now. You can also call them between 12 and 7 every day at 1-844-227-3844. And again, you can go online to book an appointment as well. And don't forget to call your family doctor if there's an issue that they can help with. Until next time, stay healthy.